Alex Earle here, and it's Hump Day with Dr. Alex Earle. And this is the time I get to spend with you guys and answer all your plastic surgery questions and also go over the most exciting plastic surgery topics and of course education and everything else. But today we're super excited because we are talking about something new that is about to come here soon to Pure Plastic Surgery. And it's something that, it's garnered a lot of interest. We put a post about this maybe a couple weeks ago, and it basically just blew up. Like a bunch of people interested in this. They want to find out more. What is it all about? And yes, we are talking about the rib revolution. That's right, the rib revolution. These are basically brand new techniques in order to remodel the ribs so you can get that smaller waist. That's right. And so the question was, when I did the post a couple weeks ago, was, are you willing to crack your ribs for a smaller waist? And surprisingly, or perhaps not that surprisingly, there was a lot of people that said yes, but they wanted to find out more because they kind of heard rumors about this, things in the past. And the reason why it's coming here today is because we've now basically developed a technique to do this in a way that is very, very safe, with minimal scarring, which is really the revolutionary part about all this, right? Because you may have heard, like back in the day, you may have heard of, certain famous people, maybe like Cher or someone like that, who, the rumors were that she removed some ribs. Some people say they had some rib removal in order to get that smaller waist. And of course, a rib removal is a much bigger procedure, right? You're gonna have to need a bigger incision, and it's a little bit more morbid. You're actually physically removing the ribs. And so that's like a big surgery, right? But what we're talking about here, okay, is first of all, what is it not? It is not rib removal, okay? So we are not removing any ribs. I want that to be perfectly clear. That's what makes it so much different from things that were potentially done in the past, which were perhaps a bit more radical and, a little bit more morbid for the patient in terms of that surgery, right? So we are not removing ribs, okay? What we are doing is we are remodeling the ribs, okay? So this is a rib remodel procedure, okay? And so what does that mean? Well, if you want to say it in technical terms, what we are physically doing now is that we are doing a controlled fracture of the ribs, okay? And how do we control it? Well, I'm going to get to that here in a second. But what you want to know is that the ribs, like most kind of longish bones, right? They have what's called the outer cortex and the inner cortex. These are the hard part of the ribs, right? And then inside they have that softer part, typically filled with marrow, right? And so many bones are like this. The ribs are like this, your arm bones, okay? The leg bones, okay? So your femur, your humerus, all right? All these bones are similar. So you got the outer cortex, you got the inner cortex. Inside is kind of soft. It's where the marrow lives, okay? And so what we're doing with this procedure is that we're creating a fracture of only the outer cortex of the rib. So you're only basically creating a small cut in that outer cortex in a very controlled manner. And that's what makes this procedure safe, okay? And so when you cut only the outer cortex and you then apply a little pressure, what happens is that a rib that is kind of shaped like this, you apply a little pressure, now it can be shaped like this. And so if you have a little bit of a wide rib cage, okay, you make that outer cortex cut, you put a little pressure, and then you can bring things in, and that's what's gonna make that smaller waist. Especially for people that either have a wider rib cage or they're on the thinner side, and it's tough to like really create an hourglass figure because they are so thin and they don't have that much outside fat to create those hourglass shapes, okay? So that's exactly what it is. So now you may be asking, well, how are you doing this in a safe and controlled fashion? Well, that's really the innovation here. Two things. Number one, we're not making any large incisions, which is crazy, right? You would think, oh my God, they're doing this, they got to break 3 ribs per side, there's going to be a whole bunch of scars. No way. Every one of these is done individually over each rib with a tiny 18 gauge needle hole. All right? That's crazy. I'm talking a needle hole that's about the size of the tip of this pen. That big, okay? That's what we're doing. And so we're using that 18 gauge needle to create the opening over each rib. And then through that needle hole is where we use this special device. Are you guys ready? And this just arrived here today, which is why I'm super excited for show and tell. We're going to use this special device here, which is called piezotome, which is a device that uses basically water and ultrasound energy to cut specifically and only through bone. That's right. So the piezotome is specifically designed to only cut bone and nothing else. So that's what makes it so safe. And so then with this device, you can use a tiny tip. Check this out. I don't know, can you see it in the cameras there? Look how small that tip is.
Right here?
Okay? Yeah, check it out. See how small that tip is. So it's only basically the size of an 18 gauge needle. And using that little tip, we can go in and with this type of movement, create that cut on that outer cortex. Okay? And yeah, and of course, well, it has a foot pedal, so the foot pedal is how it works. But that's exactly what we're doing there, okay? So really, really cool. And that's the reason why we can do this now in a controlled manner, in a very safe manner, with basically a no scar technique, okay? No scar technique. So, which are the ribs that we are basically doing the remodeling for? It's the lower ribs. Some people call them or not some people, they're called the floating ribs. So it's gonna be your ribs 10, 11, and 12, which are going to be the lower floating ribs. That's why those are the ribs that you can actually fracture and bring in. They're not attached to the front, okay? And that's why those are the ones that you can then use to create the smaller waist, okay? So it's floating ribs 10, 11, and 12, okay? However, who is this for though? It's not for everybody, right? Like a lot of the things that we do, not everyone qualifies for this, all right? And so in order to be able to do it in this fashion, where I'm using the 18 gauge needle and then the piezotome with that tiny needle, well, one of the things that I have to be able to do is that I have to be able to actually palpate the ribs, like actually be able to feel the ribs, right? So if there's too much fat covering those ribs, I'm not going to be able to do this procedure, okay? And so that's why this procedure is for people that are on the lower BMI range, typically BMI of 25 or less, okay? And the reason is exactly that. I cannot have too much fat covering those ribs. I have to be able to actually touch and palpate the ribs. And the device, which you see here, of course, is not super deep. I have to be able to reach that rib, okay? So if I have too much tissue, too much fat covering the ribs, I'm not going to be able to do it. So this is more for your thinner patients, your lower BMI patients. But at the same time, those are typically the patients that need it the most, right? Because if you're a little bit on the higher BMI and you have more fat, then we're able to shape and contour the body just doing the liposculpture, the liposuction, liposculpture by itself, and not need to do anything additional such as the rib remodeling. However, if you're very thin, there's only so much we can do, right? There's only so much that we can do in terms of bringing in the waist. They usually have limited fat, so almost so much we can do in terms of widening the hips. So it becomes a lot more difficult to then create more of that hourglass shape. And so that's where this comes in. We can do an additional procedure to then bring those ribs together and really make that waist small so you have more of that hourglass shape, even if you're, fairly thin, okay? The other thing that needs to be taken into consideration is, of course, only for healthy individuals, right? We are doing this in an outpatient surgery setting. This is not a hospital setting, so you have to be generally in good health. And it's typically for younger individuals as well, typically 45 years old or less, because we have to have healthy bone. We can't have bone that it has what's called osteoporosis, which typically happens in women after menopause. And so if you undergo menopause and the older you get, the bones become more brittle. And again, remember, what we're trying to do here is keyword controlled fracture, right? And so if you have a bone that is too brittle, too much osteoporosis, too old of a bone, when you go to bring that bone in, you can potentially create fractures in areas that you don't want. And of course you don't want that. So it has to be healthy bone. So that's typically we're going to do it for patients that are 45 years old or less. Okay? And then the last thing I put here is no pulmonary issues. Of course, Well, we wouldn't want that for any surgery, but in this particular surgery, you also have to think about the fact that you're going to be wearing a corset that's pretty tight for the next 3 months. And so you have to be someone that doesn't have any pulmonary issues. You have to be able to, breathe with no issues, especially even if you have a very tight corset on at that time, okay? So that's for who it is. What are some of the key elements in terms of the post-op? Well, it's exactly that. Like I said, you have to wear a corset for 3 months straight, basically 23 hours a day. You take it off just to shower, okay? So there is a commitment after surgery in order to get this to work. Now, why is that? So think of it like when you break an arm and you have to wear a cast, right? You're immobilizing the arm so that the bone is able to heal. Well, it's a very similar concept here, right? So now you have this rib that started off like this, then you made your controlled fracture, right? And you brought the rib in to make that waist smaller, but now it has to heal like this. And so it has to be immobilized. It can't be moving around, otherwise it won't heal properly. So it has to be immobilized in that new position. And so the way to do that is by wearing that corset, which, like I said, you have to have it on basically all night, all day. You take it off just to shower, and that's it. So there is a very important post-op commitment for this surgery, okay? When do you start wearing the corset? Well, if you're doing just a standalone procedure, meaning that you're only doing rib remodel, nothing else, you get into that corset next day, okay? Either right away or the next day. Now, if you are combining it with another procedure, which you can do, you can combine this with most procedures, whether it's a breast procedure, a tummy tuck, a liposuction procedure, or BBL. Then we're not going to put the corset on till about 5 to 7 days after your surgery, if we're doing it with something that's also kind of around the belly area. So for example, if you're doing rib remodel plus lipo 360, or rib remodel plus BBL, or rib remodel plus tummy tuck, well then you're not going to be putting on the corset until 5 to 7 days later, so that we can make sure that the skin's doing okay, the skin's looking good, before we then put on that tighter, tight compression, okay? And also similarly, if you are combining it with something else, for example, the liposculpture or the BBL, the corset will go above what you usually wear for that, which is your foams and your faja, right? So you have your foam, your faja, and then your corset if you're combining the procedure, okay? Does that make sense? All right, so these are this is what it is. And like I said, it is not a rib removal, it is a rib remodel. It's done in a very controlled way with new technology and in a way that will leave, it's virtually a scarless technique. All right, I'm happy to take any questions.
Okay, let's start with the topic.
Yeah.
Is it the same as rib remodeling that other surgeons already do, or this is something new? Philip Locomoda.
Yeah, so it's probably overall similar, except that a lot of other surgeons were using like a 1 centimeter incision or a little bit bigger incision in order to do this. And so the difference here, the advanced technique, is to do it through that tiny 18-gauge needle hole. That's really the big difference. And so what allows me to do that is this special device that I have here.
If you get the rib remodeling done first, how long do you have to wait to have a BBL?
Oh well, if you're gonna do it separately, then you're gonna have to wait a minimum of 3 months. Like I said, you're gonna be wearing that corset for 3 months. You have to make sure that the bones heal in their new position. And once that is fully healed, then you can go ahead and do the next procedure.
I had kidney problems, but I had surgery, so I don't have any problem no more. Can I get a BBL done?
Well, I mean, so the short answer is, I think, potentially yes, but of course we would have to get you cleared, right? So we would get your labs, make sure the kidneys are functioning well, there's no problem, and we would also get a medical clearance from your primary care doctor. And if all that checks out, then yes, we will be able to do the surgery.
How long after having a kid do you have to wait to get a BBL?
So I typically I say you want to wait at least 6 months, okay? Because your body, goes through a lot of changes with pregnancy and then giving birth, and then things, start to bounce back, and you want to reach basically a good kind of baseline level before undergoing a procedure. So I would say minimum 6 months after giving birth.
Okay. What's the risk of the bone break off after you fracture it?
So of the bone breaking off, I mean, like I said, it's all through tiny, tiny incisions, so the bone shouldn't really be going anywhere else. And so you do your controlled fracture, and then you got to set it into place. And then yes, the key thing is wearing the corset so that it's set, right? Because if you're not wearing this properly and if there's movement, then you can have a delayed healing or a non-union, meaning that the bone doesn't heal, and you don't want that, okay? So you definitely want the bone to be very still so that it's able to heal. So that's why this component is so important. It's completely, it's mandatory, right? It's not like an optional thing or something that you can forget about, like sometimes happens with the faja, right, guys? With the Lipo 360 or the BBLs. This is something that is super important.
Okay, can you do rib remodeling during a BBL?
Yes, so there are certain procedures that you can combine this with. BBL is one, Lipo 360 is another, even tummy tuck, okay? You can basically combine it with almost any procedure, including your breast procedures as well.
Is it better to do it on its own or combine it? Which is safer?
So, well, in terms of if you want to go from a strictly kind of safety point of view, right, every time you combine a procedure, you're combining also the risks of one procedure plus the risks of the other, right? So anytime you combine any procedure, it's always going to be riskier, a little bit riskier than just doing it on its own, okay? Having said that, it is, very reasonable to combine it with, procedures that have to do with the similar things. So like Lipo 360s and BBLs, it's very reasonable to combine it there. If you want to go for you want to be like the absolute safest, and you don't mind, traveling a couple times or going under anesthesia a couple times, then yes, you can stage it. But if you want to just try to get it all done at once, it's very reasonable to do so.
I've never had surgery, so how would you know if you won't have a reaction to anesthesia?
So overall, reactions to anesthesia are quite rare with the gases and the medications that are being used nowadays, okay? That's not to say that it's of course impossible, but for the most part, people who have never undergone anesthesia, they have no problems undergoing anesthesia in their first time. Certain medication, we do ask certain questions. For example, if there's a medication that has some cross reactivity, with people that have allergies to, say, egg allergies or things like that. So we ask you, have you ever had an allergy to eggs or an allergy to shellfish, right? So that gives us a clue as to what medications we should or shouldn't use. But as long as you answer all those questions, it's generally very, very safe, and the chances of having a reaction are extremely low.
Okay. What complications could possibly arise down the road?
With the rib remodeling,
yes, correct.
Okay, good question, right? So what are the potential complications? So one of the things that we have to be very careful with, and that's why we want to do this in a controlled fashion, the one thing that we probably worry about the most is what's called a pneumothorax, okay? So I'll just put the abbreviation here, so PTX, pneumothorax. What is a pneumothorax? That's when air gets trapped between the lung and the lung cavity or the thoracic cavity, okay? So if you poke into that space, right, and you poke into a lung, then of course that can cause a pneumothorax. So you want to have this to be a very controlled reaction, but very controlled fracture. But what makes the risk of that very, very low is the ribs that we are treating, right? Because typically those floating ribs, those very, very low ribs, ribs 10, 11, and 12, are actually not really within or near the thoracic cavity. So while the risk of pneumothorax exists and you want to be aware of it, the risk is pretty low, given the number of ribs that we are treating, which are 10, 11, and 12. The other thing that you have to potentially worry about is bleeding. Again, so the ribs that have the bigger neurovascular bundles or the bigger arteries and veins are the upper ribs. So basically from 9, so 1 through 9, okay? And again, 10 sometimes has vessels, sometimes not. 11 and 12 never have vessels. So if you're treating 11 and 12, that risk is extremely low as well. And if you're 10 also pretty low. What you don't really want to do is start treating ribs above that, because then you can get into trouble.
I already booked my surgery with you for BBL. Can I come to see you in person to make sure I'm a candidate for rib remodeling? Also, I want to add buccal fat removal and body tight.
Okay. So yeah, can you come to see us in person? Of course, you can certainly do that. You can call your coordinator and they can set that up. And then in terms of combining the ribs with the BBL, that is a possibility. Like I said, I'm not sure when your date is. Right now we just got the machine here today, and I'm waiting still for some special tips that I need. So we're thinking about not launching the rib remodel till probably either late August or early September. So just keep that in mind, okay? But yeah, certainly we can at least get the evaluation part of it going. Body tight, if you need that for certain areas such as the arms or the thighs or the chin, is certainly a possibility to help with the skin retraction. Buccal fat removal, I don't do that personally. Dr. Vidal, who's here, she does a lot of our face surgery, so she can do that if needed. But like I said, for most patients, I would say for most patients, I don't recommend it unless you have like a ton of fat in the cheek area, because it just makes the face look like older, like when it sinks in like that, right? So for most patients, I typically don't recommend a buccal fat pad removal.
I have my surgery booked with you for August 6th for a tummy tuck with a breast lift, mommy makeover.
Okay.
Which procedure would you start with first?
I typically start with the breast procedure first, with or without an implant. But yeah, you do the breast first, and then I'll move down and do the tummy.
Okay, the patient that asked to come in person, her surgery is in 2026.
So then yeah, you got plenty of time. Yeah, we'd love to see you in person.
Dr. Earle, what's the longest you will have someone under anesthesia for plastics?
So I typically don't like to have patients under for more than 4, maybe max 5 hours. So remember, we're doing everything here in an office space, outpatient surgery setting. So you really want to control the amount of time that the patient's under anesthesia. I would say most of my surgeries are, not much longer than 3 or 3.5 hours. Maybe I'll have some that go into 4 or so, and it'd be pretty rare for me to do anything above, up to 5 hours, and I don't do anything above 5 hours.
Okay, how big is the incision for the rib remodeling?
So it's a tiny 18 gauge needle. So I wish I would have brought a needle with me, but if you look at the tip of this pen, it's about the size of the tip of the pen, because you can use also the tip of the piezotome, which you can see here, similar, right? A tiny incision over each rib. Basically a scarless technique.
Like a mosquito bite.
That's right.
How many hours it take to get a BBL done? Only a BBL.
Only BBL? So I wish I could just give you like one number, but it depends on the patients, right? So say you're a patient that's coming in with a BMI of 23, you just want a nice enhanced natural result, and that's about it. And we're not doing any add-ons. It could be as quick as an hour and a half. Now say you're a patient then with a BMI of 29, okay, and you have lots and lots of fat for me to remove, and you're also adding thighs or arms or chin, right? So it can be as long as 3 hours. So there's going to be a range there depending on the patient, also depending how tough your fat is. Not all fat comes the same. Some patients have fat where it comes out super easy and super fast, and some patients have fat where you really have to work at it. So it's going to be a pretty wide range there.
Also, does remodeling affect organs in any way?
So no, it shouldn't be affecting any organs in any way. And so with the corset, it's also a little bit of a gradual thing, and perhaps I should have explained that also. So at the beginning, the corset, it's going to be, fairly tight, snug, but it's, you're going to be gradually, bringing it in over the course, especially the first 10 days, and then perhaps after that. So it's going to be kind of like a slow, gradual process where you're bringing in a little tighter, a little tighter, a little tighter as you move along.
Okay. How long does the patient stay in the recovery room after a mommy makeover? More or less.
Yeah, so you're going to be there at least an hour. An hour is actually the minimum amount of time that you're going to stay there. And then if you need some more time, that's okay. So we have, patients will stay at least an hour, some will stay an hour and a half, some 2 hours, depending on what you need.
Can my wife get a total define with HD lipo and also breast implants?
So total definer, HD lipo, breast implants, it's a possibility depending on her BMI. So if she's got a little bit lower on the BMI scale, then yes, it's something that we could do. And so we can do, basically a lipo 360 with high definition and the breast procedure. It's basically kind of like it's what we sometimes call Miami makeover, where we're combining a breast procedure with lipo 360 and we're just adding on some high def or ab etching.
Okay, Doc, I have like 10 questions about pricing, bookings, dates, and all take us to www.
So in terms of dates for the rib remodel, like I said, I'm probably going to start doing this in late August, early September. So that gives all of us time. You guys get ready, send your photos, I can look at them and make sure you're a good candidate, and we're all set. Okay. Where you want to go? You want to go to our website. All right. So that's going to be, let's put it here, www.pureplasticsurgery.com. That's right. So go to our website, www.pureplasticsurgery.com, and there you're going to find a button that says start your journey, or you can also go to where it says virtual consultation, and then you'll be able to fill out a questionnaire and send in your photos. I'll be able to take a look at all that information, look at the photos, and then make my recommendations. And so I'll have one of my patient care coordinators reach out to you with the recommendation, okay? And that's the easiest, fastest, most efficient way to get started, okay? Of course, you can always call us as well. So let me put that up. That's 305-230-4326, okay? But like I said, probably the fastest, easiest way is to go through our virtual consultation on our website.
Okay, so, this is like an affirmation. So, we can do both mommy makeover and BBL at the same time?
No, so not that combination, right? So here, there's multiple reasons for that, okay? But one of them is that here in Florida, when you do an incision, like a tummy tuck or a breast incision, then you're very limited as to how much fat you can take out, which is 1,000 cc's. And that's typically not enough fat for you to do a complete liposculpture 360 and then fat transfer in BBL, okay? So I do highly recommend separating out those procedures. I always recommend doing the procedure with the tummy tuck first. So either your tummy tuck or mommy makeover first, and then come back 3 months later to do your BBL, okay? The other thing is complications. So as you like I said at the very beginning, the more stuff that you add on, you're adding the risk to each individual element, right? And so when you're combining a mommy makeover, which is a breast procedure with a tummy tuck and liposculpture and fat transfer, well, the risks start to accumulate and go up significantly higher. And I'm talking about risks of things like blood clots, like DVTs, deep vein thrombosis in the legs, or pulmonary embolism in the lungs. I'm talking about risk of infection or bleeding and the need for blood transfusions. All those risks go up when you combine all those procedures. So I'd rather separate them out.
How many weeks do you need to wait until you can sit on your butt after a BBL without the pillow? One doctor said 2 weeks, but seemed a little low.
Yeah, I think it's a little low, at least for me. My preference is that my patients do not sit directly for at least 6 weeks.
Okay. Do you recommend a BBL first or the rib remodeling if you want to separate these procedures?
So if you're going to separate the procedures, then I recommend doing it could be potentially done either way, okay? But I do recommend doing the BBL first, okay? Because that way, you get, as much as we can get simply with the liposculpture and the fat transfer. And then you actually even have a chance to see like, hey, do I like it? Do I still want the rib remodeling? And if you're like, yeah, I still want the rib remodeling, then great. Okay, 3 months later, we can go back and do that. And the other good thing about that is that I've done a lot of liposuction to the back area. So now there's less stuff in between the skin and the rib, which will make the rib remodeling part a little bit easier for me as well.
Okay, one more. Can we?
Yeah,
We're
sure.
over time, but can you return to work after 3 weeks of having a BBL?
It depends on the work. So if it's an office type setting or you're working like from home, things like that, then yes, typically at 3 weeks, that's okay. Because most patients are even driving by 3 weeks after the BBL for sure. Now if it's work that requires heavy lifting or strenuous activity, such as certain nursing jobs, for example, you're a police officer, firefighter, things like that, then you won't be able to go back to work until after 6 weeks from the procedure. All right? Okay, everybody, so exciting new procedure. I hope this explains a lot. I know there was a lot of questions about it. So I think we kind of got through all the major points there, but if you have any more questions, just write to us down here in the comments below or shoot us a DM, all right? We'll be happy to answer. And I look forward to seeing all of you next week on Hump Day with Dr. Alex Earle. I'll see you then. Ciao.